Welcome to Part 1 of this Dementia Training Program, the CMS Activity Regulation and Overview. In Part 1, we will review the federal regulation related to activity involvement in nursing homes and why it is important. This background is a good starting point for a couple of reasons. First, all team members should know the rules that their employer must obey. And second, the rule exists for a good reason: to address the often unmet activity needs of older adults living in nursing facilities. As noted on the slide and in your handout, there are two learning objectives for this part of the training program. At the end of Part 1, you should be able to discuss the CMS activity regulation, which is also called an F-tag, and be familiar with the ways you can help the team be in compliance with the regulation. Under the new rule, each team member has a job, so knowing what you are expected to do is important. You should also be able to describe the benefits of individualized activities for residents with dementia, and there are many benefits. Before we move ahead, let's define who and what CMS is. CMS stands for the Centers for Medicare and Medicaid Services, which is a U.S. federal agency that administers Medicare, Medicaid, and the state children's health insurance program. Nursing facilities that use Medicare or Medicaid payments are responsible for following CMS rules and regulations. The rules are enforced by states through a process that is commonly called the state survey. You may be familiar with this process. If the facility is not in compliance with the rules, which simply means they are not doing what is asked in the rules, they may be cited and fined. This causes a lot of distress for everyone involved, and is avoidable by knowing what is expected. The CMS rule is on the slide and in your handout. Let's think for a moment about the key parts. The rule says that the program of activities for each resident must be ongoing and based on a comprehensive assessment. The activity plan must be designed to address the person's individual interests and meet the person's physical, mental, and psychosocial needs. In other words, activity programs must be designed with a particular resident in mind, and must reflect both the person's interests and abilities. Under the rule, taking the person to a large group activity like bingo or watching a movie won't be acceptable unless that activity reflects the person's interests and needs. A key definition that is used in the CMS activity rule is also included in your handout and listed on the slide. Let's think about it now. An activity is defined as anything other than routine activities of daily living, or ADLs, like bathing, grooming, and dressing. So be creative. However, activities are not just filling time. They need to have a purpose. That purpose might be to help the person feel pleasure, or comfort, or a sense of accomplishment or creativity that increases their self-worth and well-being. Other purposes might be to enhance the person's physical health, their cognitive or thinking abilities, or their emotional health. In other words, the activities need to be meaningful. They need to have a positive effect on the person. To develop meaningful activities, caregivers must know the person well. Even though they are no longer defined in the CMS rule, some other helpful definitions follow. The phrase person appropriate means that activities need to fit this person and his or her specific needs, interests, culture, and lifelong patterns of living. Because so much time is spent addressing residents' disabilities and care needs, caregivers may forget that this frail old person has lived a long life full of interesting experiences. That is particularly true for residents with dementia who may not be able to tell their stories the same way the other residents do. That brings us to the definition of one-to-one programming. Some residents, like those with dementia, may not be able to plan activities for themselves. One-to-one programming doesn't necessarily mean one-to-one activity. It means that staff will need to help residents identify and engage in meaningful activities. In short, it is your job to figure out what the person with dementia enjoys and can do successfully, and to help cue the person to be involved. Finally, the program of activities can include large and small group, one-to-one, and self-directed activities. As before, the program is ongoing, person-appropriate, and based on a comprehensive assessment of abilities, needs, and personal interests and preferences. Developing, implementing, and evaluating the effectiveness of person-appropriate activities for persons with dementia is your job. When the state surveyors come to your facility, they'll be looking for a number of things that indicate if the facility is meeting the residents' activity needs. For example, is there evidence that the program of activities is ongoing? Does the person have something interesting and meaningful to do throughout the day? The notion that activities are an hour-long program offered once a day, 5 days a week, isn't enough. Surveyors will also be looking for evidence that activities are person-appropriate and based on group or individual needs based on the care plan and individualized assessments. They'll question if the activity fits the person's interests, needs, and preferences, and matches the person's current level of ability and function. Surveyors will also be looking at factors in the social and physical environment that may contribute to helping the person engage and enjoy activities, or on the other hand, things that may interfere with activity involvement. The state surveyors will talk to a variety of team members related to activity involvement, not just the staff who work in the activity or recreation department. As part of their investigation, they'll talk to the resident's representative or family member, activity or recreation staff, nurses, and social services staff. In short, the entire care team has a role in assuring that the program of activities works well for individual residents. Cooperation among team members is critically important to assure that the care plan reflects a person-appropriate program of activities, one that is based on a comprehensive assessment of interests, needs, and abilities, and that methods to assure ongoing involvement are in place. Surveyors will be looking for evidence of compliance with the activity regulation using the very things we have been talking about. First, they will look for evidence of staff conducting individualized and comprehensive assessments of personal preferences and choices, physical and mental conditions that may affect function, and problems, needs, and behaviors. They will also consider whether the program of activities reflects the person's individualized interests, needs, and goals. The survey team will evaluate if the care plan is working or not, and outcomes related to activities should be documented. If the person doesn't respond well to an activity, their care plan should be changed to better meet their needs and abilities. On the one hand, the regulation seems to ask a lot of staff working in nursing homes. On the other hand, the rule was created in 2006 for a long list of important reasons. The regrettable truth is that nursing homes were first developed to work like hospitals and have long placed more emphasis on physical care than the social or psychological well-being of residents. Like this picture suggests, too many residents sit for hours and hours each day with little or nothing to do. In fact, when the rule was written, evidence suggested that as many as 60% of residents in nursing homes had nothing to do, which is a pretty sad way to live. Their activities of daily living, getting up, dressing, grooming, eating, and bathing, were the sum total of their day. As most of us know, there are many benefits to staying active at any age in life. The old saying, use it or lose it, is particularly true as we grow older. In too many cases, the less we do, the less we are able to do. We lose function by sitting around being idle. Being involved in enjoyable activities contributes to our sense of meaning in living and helps us maintain our physical and mental abilities. Involvement in meaningful activities is just as important for persons with dementia as it is with any other human being. The thinking impairments that are part of dementia make it difficult for the person to express their needs and desires and make plans to engage in activities that are enjoyable. But that doesn't mean that persons with dementia don't have activity preferences and needs. The CMS regulation recognizes this by calling for individual programming, which means that you, as staff caregivers, need to think about the person's ability and needs and plan accordingly. There are many benefits of involving persons with dementia in meaningful activities, from reducing behavioral and psychological symptoms to improving the person's level of independent function. The research that led up to the change in the CMS activity rule in 2006 included interviews of older adults living in nursing homes. The message these older adults sent was loud and clear. They wanted a variety of things to do, including things that actively engaged their minds and bodies, activities that were active, productive, useful in some way, that allowed for socialization not only with their family members, but the larger community in which they lived. And they didn't want to be treated like children. They wanted age-appropriate things to do and things that fit the unique interests of their gender. All residents have a need for engagement in meaningful activities. For residents with dementia, the lack of engaging activities can cause boredom, loneliness, and frustration, resulting in distress and agitation. Activities must be individualized and customized based on the resident's previous lifestyle, occupation, family, hobbies, preferences, and comforts. As before, CMS is very clear that residents who are unable or unwilling to develop their own activity plan must be helped. Some basic principles related to dementia care, like simplifying tasks and activities to match the person's current level of cognitive and physical function, using retaining abilities and long-term memories, and using attention span to gauge the length of programs. The point is that staff need to adapt what they do to match the person with dementia's needs, preferences, and characteristics. The regulations also provide ideas about the type of activities that may be most appropriate for persons with dementia. The examples listed on the slide and in the handout are only that, examples based on specific behaviors. However, they emphasize the importance of offering a variety of activities, including ones that are conducted in small groups or done alone with cueing from staff. In summary, there are many opportunities to engage older adults with dementia in meaningful and enjoyable activities. However, what is meaningful to one person may be a total bore to another. The rules really call for knowing the person, including their interests and preferences, long-standing habits and patterns of living, current abilities and limitations, and things that have contributed to feeling like a worthwhile and valuable person. In Part 2 of this training program, we'll review assessment tools that provide a basis for selecting meaningful and person-appropriate activities for persons with dementia. Although the activity rules may seem to add a lot of work, we need to remember that they exist for a reason. There are many unmet needs among older adults living in long-term care settings like nursing homes, and those unmet needs are particularly acute for persons with dementia. In some important respects, the activity requirements create an environment of cooperation and shared responsibility for the residents' well-being. Teamwork, more than ever, is the key to success. And as we talk about in Part 2 of the training, engaging residents with dementia in a program of meaningful activities may reduce difficult behavioral and psychological symptoms of dementia. By thinking about ways to meet the 24-hour-per-day, 7-day-a-week preferences and needs of persons with dementia, caregivers can increase positive behaviors and improve quality of life, including the quality of their own work life. That concludes Part 1 of the training program. To help you put this information into practice, we have developed an exercise for you to complete. Please locate the Part 1 exercise in your handouts and work through that list of things to do. This is an important part of your learning and essential to the next parts of the training. When you've completed the Part 1 exercise, go on to Part 2.